Cool. So Jeff, I know we talked a little bit before, but still like, can you introduce yourself for the audience?
Yeah, my name is Jeff Ruiz, and right now my job is that I'm a senior director of rehabilitation for the Miami Heat. I serve a role to where it's basically a hybrid role between the training room and the weight room, and I really try to focus on a lot of criterion-based progressions and stuff like that with my athletes over the last decade or so, trying to make sure that everybody, when they are returning to play, it's not going to affect their performance too much. Uh, I am a Miami native, so I got to come back home right now. And yeah, basically just been in the sports arena for the last decade or so, probably a little bit longer. Um, I graduated from University of Miami, and I was a I was a strength coach and a personal trainer before like PT school, and then I was working basically as a trainer and helping people uh, kind of just go at random different gyms, etc., all throughout grad school. But really throughout grad school, I started to intern in athletics, and I helped primarily with high risk people, high risk patients, and everything coming back towards actually like trying to rehab, but as well as also make functional adjustments for somebody while they're in a state, but they still needed to train. That was kind of how I got my into athletics. I wasn't an athletic trainer, so there were just certain limitations that I couldn't do. You know, I wasn't necessarily in the best spot to try to land a sports job. So what helped me was my strength and conditioning background. Um, I I've been I was at University of Miami for about 6 or 7 years. I worked up to being the director of rehabilitation. I was an assistant strength coach with track and field, and then I went up to DC, and I was working as the director of rehabilitation for the Washington Commanders for the past 3 seasons, really two and a half. And then I got the opportunity to come down to the Miami Heat, and that's the position that I'm at right now. So I'm currently getting my PhD in kinesiology and really focusing on a couple different things, more with sports science, looking at DSI and seeing if flywheel training is a viable option to go ahead and possibly affect somebody's DSI. So yeah,
Nice,
that's
nice,
me in a nutshell for right now,
nice,
professionally. Yeah,
nice. Um, so since prior to the Heat, you also work with football. Um,
Mhm.
what are the main difference between working with football and working with basketball?
So I'll say that they're both very technical sports. Um, I would probably allude to the fact that I consider football a collision sport, not a contact sport. I mean, you are deliberately going ahead and colliding with another human being up to 22 miles an hour. And it's a different level of aggression and violence, I feel like. However, there's a lot less games. So the biggest difference is I would probably say that there's a lot more repetitive trauma to an athlete that's playing basketball, maybe, but it's not necessarily as violent, you know. That's that's probably the biggest difference, obviously, and then the technical differences from just shooting to defense, everything like that. But they're both amazing, and blessed to be working to have worked with both for sure.
Nice, nice. So, uh, today I want to talk about like ACL injuries. I want
Yeah.
to start with like those like injury mechanics. Can you talk a little bit about like the injury mechanics?
Yeah, for sure. So I think when there's a there's a couple of different classifications that I do that I think of myself when I'm thinking of an ACL injury. So obviously non-contact versus contact. So contact kind of throws a whole other variable in the mix in the sense of uh like you don't know exactly what you're able to control from a contact environment. So, especially when it's a collision sport such as football or something else in the environment that they might be slammed on in any other sport, something like that, it's going to cause a lot more issues in the sense that you're not able to really recognize how to prevent that as much. And it's you can really have a bulletproof program to try to help with injury prevention, but certain things, if you have a helmet coming into a leg at an extremely high rate with a lot of force, it's not going to necessarily be able to stop that. That's just an act of God. But when I think of deceleration based injuries or basically non-contact injuries, I primarily think of issues a lot of the time with high speed decelerations in my eyes in some capacity, whether that could be from a land or that could be from somebody trying to go ahead, plant and change direction. Uh, the overall the overall capacity for somebody to be efficient with their movement and slow down from a high speed is something that's a gift, but it takes a lot of training to get to. And I think of an ACL injury, a lot of the time you're going to have externally rotated tibia, internally rotated femur, try to go ahead and stop, and something gives, you get a little bit too much anterior translation of the tibia, specifically because that person's foot might be kind of in that groove to where they're not going to get as much bony congruence, or their dynamic knee stabilizers aren't going to necessarily counteract that force and puts too much stress on the inert tissue, and then you can have that injury. I also think of possible hyperextension injuries too. Somebody may be leading with their heel or something too much, cast out a little bit too much, try to go ahead and slow down. Maybe it's at the top of a route, or it's at on a Euro step or something like that, and just a little bit too far outside of their base, a little bit too much force, and that ground reaction force counters up, causes a little bit too much shear and too many high forces for it to be countered by those knee stabilizers, and their tibia goes too far forward, and an ACL injury can transpire. For the most part, that's usually what I would like consider like things that I've seen the most. I've seen a lot of different ACL injuries throughout the year, but especially the ones that are the most common. I would say that for sure.
Nice, nice. So, uh, after I understand, like after I work with sports more and more, at the beginning I'll say like, I'll ask like how to prevent those injuries, but like now I'm like, no, you can't really prevent those injuries. So I'll just ask like, uh, after like an athlete like suffer from ACL injury, like, uh, first of all, like I know there are different types of surgery. Like sometimes they like pull tendon out of their like hamstring, and sometimes they're like pull like a part of the patellis tendon to become like the ACL. So does those like kind of affect like the benchmark or the timeline for ACL return to play?
Uh, Not necessarily always the timeline, but the approaches that you would take and the considerations that you would have for sure. So it's usually probably a gold standard right around now is about 9 to 12 months. You can say sometimes people can say 6 to 9 if it's really accelerated, but gold standards probably about 9. Just from the tissue actually becoming ligamentized and really being absorbed by the body. Allografts aren't usually as used. I haven't had as many experience with them, especially in sports medicine at this capacity, whether it was collegiate or professional. But I think some of the things that you need to try to consider when you do have uh, something that is like a BTB or patellar tendon graft or or a quad tendon graft versus a hamstring is maybe that basically some procedures might elicit a little bit more pain than others with functional activities down the road or just kind of in general. And also, if somebody does have a hamstring graft, maybe they might have a little bit more of a deficiency down the road because certain tissues are now kind of a little bit more compromised. And um, I would probably say the most common ones that I've seen throughout my career have been uh, patellar tendon, BTBs, or quad tendons. I haven't seen as many hamstrings throughout the years now, but that's not to say that it doesn't happen or that it's wrong to do so. It's just my personal experience.
Cool.
So yeah,
So, can you like quickly walk us through like the ACL return to play like protocol, like start from the beginning, and how would
yeah,
you like help them return to play when they hit each benchmark?
yeah. So hitting each benchmark, that could be a tedious talk right now. Definitely to say each specific benchmark, but I'll kind of summarize it up for the most part. Let's say if you're going through the biggest concerns as well as just kind of the overall goal that you want to try to accomplish per like kind of phase. In that sense, I would say for the first like let's say 8 weeks that you're trying to get towards, in my opinion, unless there was some type of meniscal repair or other ligamentous injury, you really want to try to get, in my eyes, full range of motion within those 8 weeks. And that might not necessarily be functional in the sense that, like in a weight bearing capacity, but just from like on the table, trying to make sure that they're actually able getting to get to full extension for sure. Because if somebody's lacking full extension, even 1 to 2 degrees can affect their gait, can affect a million different ways for them to actually optimally strength train or resistance train, or obviously down the road further into more explosive activities. But so making sure that full range of motion from knee extension as well as flexion is something that they're gonna really start to get optimized and equal. Now, it might not become absolutely equal in the sense of like to the other leg completely within 8 weeks, but you want to try to get to at least around 120, 120 degrees of flexion. Um, I'm not of the mind that they need to get into extreme hyperextension or record bottom. I do think that yeah, they you want it to be available, but I'm not of the sense that if the other leg has 12 to 15 degrees of hyperextension that I need to get that from that other leg. That's just not my school of thought. Some people might argue against it. I would probably keep them to where it's available, but I'm not going to prop up their heel and really be cranking on something to where like it's just this. I don't necessarily see the functionality of it. I want them to have some type of tautness in the joint. I want them to have full extension, but I don't know that I necessarily want them to be able to go into a recurvatum or a hyperextension position because now in a weight bearing position, if somebody's ever in a recurvatum spot, like that's not a good spot in general for in an athletic setting as well as it's actually dangerous. But I understand that the capsule should be somewhat similar to the other. Um, Now I would say from a strength perspective, uh, there's a lot of things that I like to try to check off, and I would try to say just objectively, like I would go after more unilateral based closed chain measures, such as like step ups that are non-provocative, and then trying to go into almost like an eccentric accentuated loading series or something like that to where they're going to actually be doing like a significant amount, and then I'm comparing it leg to leg on a consistent basis, and it might even be from a smaller box to now building it up, etc. But all of those exercises are kind of different benchmarks in my head to why I want them to try to continue to get stronger. And those are things that I'm tracking objectively, as well as obviously there's a lot of different technology that you can go ahead and start to utilize. But I will say there's there's a there's a huge there's a huge uh, need to try to make sure that when they are resistance training, like let's say they're starting to go ahead and do things with a more of a closed chain, that they're not necessarily shifting off. And I would probably stick with a unilateral biased approach for a significant amount of time. And then really start to see that something's probably within about 20% of the other limb before you start to progress past certain things. And obviously you program like you would program for any other workout or something. You're not literally doing step ups every single day. You're not doing, in my opinion, you got a program to help optimize them to get to certain things. So there's a lot of different approaches that you can take. And I know the way that I've programmed over the last decade has changed astronomically. Um, so past that, I would probably say uh, I do look at dynamometry, like isometrics, from an open chain as well as also just like a closed chain perspective. Like I might have somebody looking into a mid thigh pull once they're a little bit more functional. On the force plate, I might have them doing a quad index test or something like that to where bringing them out to about 60 degrees on a either a Biodex machine or some type of dynamometer and looking at that from limb to limb and seeing if it's, in my opinion, I'll say within about, if the numbers are still relatively like large and they're kind of within the expected ranges for somebody with that body size or shape, etc. I would uh, I would say 20% is kind of good before you can start to progress to more dynamic activities. Um, by that I mean something that would be like different run series or unweighted runs or uh, gravity eliminated running, something like that. But prior to them getting to that, now I need to see that they actually have functional range. And that I mean like literally like a march series, forward, backwards, how they actually respond towards different sled drag series, how they actually respond towards different sled marches, sled pushes, uh, everything pretty much in the sagittal plane at that point. Like, not that I wouldn't incorporate other planes, but from my perspective, I want to make sure that it looks the best if I'm going to have them in an inline running position, that I feel confident that they can actually go ahead and start to institute that. And that has to look clean. Like somebody can't have a significant impairment in range of motion at that point, because then it's already I'm fighting up an uphill battle and it's not going to come out as clean, and actually the ability to attenuate the force that's going to be produced from anything like running is going to be definitely impaired. So they have good functional range of motion or very clean functional range of motion. They have good objective numbers from some type of dynamometry, as well as also looking at their actual objective measures from a closed chain strengthening perspective, primarily like unilaterally biased. That's not to say that they can't perform squats or anything like that. In fact, that it when I'm thinking that they're starting to go ahead and get a lot cleaner and they're getting a lot stronger unilaterally, then I usually will start with extreme like tempo squats or something like that, like to a box or to some object, so they're recognizing on where to actually go to. And I absolutely feel a lot more comfortable with somebody starting to hinge or pull uh like prior to an actual squat pattern, and because they're going to have less of a tendency to go ahead and shift off of it because of the decrease in knee bend compared to the other. And that's where if you're constantly training that throughout, so it won't be as hard to keep carrying it on and actually progress into developing significant strength throughout the entire rehab process. So a lot of the time, this is a good time period for them to really relearn a lot of different motor patterns and actual uh like optimize their technique, because they're going to hear a ton of different cues on how to actually go through these different compound movements. So that's part of one of the objective or the milestones or benchmarks that I would have as well, in the sense like, how does this person actually hinge? How does this person actually squat? Is it effective? Now, what's the metrics behind it? Like putting them on a force plate, putting them on a dynamometer, etc. So then now, once that's already kind of cleared and they're able to do different pre-running series, I might not have them necessarily doing true actual rudiment hops at that point prior to running. That's just my experience. I absolutely love for them to go ahead and start some light like agility work or some of the different concepts that Bouchek Snyder said for sure. I understand that 100%. And I absolutely endorse that same philosophy, but I just don't usually have them jumping, actually like truly leaving the ground, until I know that they're able to run and they're able to go ahead and counter a lot of different deceleration forces. And that's kind of where on the continuum of things, like earlier on in my career, I probably had them jumping earlier and running earlier. Actually hold off on that a little bit longer and get them strong as hell, and then start to go ahead and implement a lot more different things, because I can start to play with that force velocity curve a lot easier when I'm not dealing with a lot of the impairments that I would necessarily be facing if these people are still in kind of a state that is not as strong. So in my eyes, strength is still key when it comes to an ACL rehab. Um, so once they've already gotten to where they're doing these pre-running series, I'm talking about A skips, B skips, like different dribble series, and doing this in gravity eliminated positions, but then also actually on ground, probably with a little bit of resistance. So dribbles from their ankle, calf, knee, whatever it might be, trying to actually see how they're doing this effectively. Then I'll try to put them to where they're truly running. Once they're actually running and they've continued to really be strong in that regard, now I know like it's not going to be as hard to start to progress through other actual phases in my eyes, because now you're starting to cook with gas. You can start to like advance to inline running on land and weave runs, curvy linear runs, and then start to implement more actual frontal plane like rate of force development activities, everything that would actually be a little bit more functional, and then continue to sprinkle in more and more deceleration. And with that, then I'll go ahead and see that uh, they've actually been able to effectively decelerate, take them through a whole decel emphasis, or like really continue to train that on a consistent basis. Then I'll feel like they're effective or they're efficient enough to try to change direction, and that changes direction has a whole series too. But I never kind of skip those primary steps of continuing or to develop like getting full range of motion, strength, as well as those other objective things. Because if I'm still trying to catch up with that, and then I'm trying to get to where somebody, oh, maybe they can try to change direction or something, then I have so many other variables that can be in the mix and they're not going to be moving as efficiently. And then that's where if you have somebody that has a lack of awareness of their limb, that might be due to a range of motion deficit, and then their ability to actually snap up underneath their base and put force effectively. Um, so that those are all kind of things that fall along that continuum. Once they're feeling good and they're actually changing direction a little bit more. So if you consider different pre-running drills like actual like context to where they're leaving the ground, then I've been doing some type of low-tiered extensive plyo for a long period of time. However, now I would continue that like somebody doing now down that route, maybe they're starting to do more lower extensive plyos with different pogo series, different things to actually help wake up their system a little bit more often, and kind of get it into a multiplanar fashion. Then I kind of uh, am incorporating them to more activities that would be more and more sport specific, but really just functional or athletic in general. So different change of direction drills. Then I start to go into more like higher tiered plyometrics, and that's prepping them to really cut. And once they start to get into that, and they're developing some power off each leg, and it looks like they're actually able to absorb everything kind of effectively, and that's after a lot more exposure, then you really start to get into more sport specific like training. And that's kind of the continuum of where I would allow them to start to really get more and more exposures. And it might be lower intensity, longer bouts. So I'm just kind of getting them at a work capacity status and then starting to actually progress from there and then go into different actual blocks and different things that I'm gonna really try to hone in on optimizing their performance. So the whole entire time though, another thing that I didn't touch on right now is trying to keep them reconditioned. Yeah, so I know it's a lot of stuff that was a very weighted question, but yeah, keeping them reconditioned, and then now uh I'm not necessarily just trying to condition them at the end. They have to be starting to have a level of condition for a very long period of time. So when they actually are doing this, they're not going to have so much fatigue from their lungs that they get a lot more blood shunted from their legs, and they kind of lose the ability to kind of be as strong and effective as possible. So yeah, one of the things that like I remember just from my grad school days was a concept that it's respiratory metabolic reflex, and just the fact that like if the blood isn't gonna be uh, kind of like used properly in the sense that somebody's not having as much conditioning as they should, it's going to get shunted from their legs and go to their lungs. And I feel like that's a huge component when somebody's coming back from a return to play or trying to tap into performance, that they need to have the capacity in their lungs to really allow them to feel confident as well as also be safe for them to return. So then that's a whole build up and exposure into how they would actually be tapping into what they look like on the court and or on the field or whatever it might be, and then seeing exactly like how much exposure, how like can you keep ramping it up? Do you need to pull back a little bit? And then that's the whole last phase of really return to performance, you know?
Cool,
So
cool.
that was a summarized version. Sorry
Man,
for the rant.
no, I
Yeah.
love it. I appreciate it. I appreciate it. So, like you mentioned, probably earlier in your career, you probably like accelerate or like speed up the process a little bit more. So I know you mentioned that a little bit, but why exactly do you like uh postpone the like jumping a little bit? And what happens like if we make them like go back to the sport like too fast?
Okay. So I would say, um, I don't think I was necessarily uh like progressing them like I'm necessarily slower in a couple things. I think I'm getting them stronger and then optimizing stuff so it's not as hard to actually like express that power or that force into more like a ballistic fashion, or like I'm not having as many issues now down the road when people are starting to like run or anything. And that was just kind of for the last like 4 or 5 years of my career. It's just been kind of where I'm like thinking like, yeah, if I actually allow them to strengthen a little bit more and build up a better capacity for the extreme loads that are actually going to be presented to them through running in different change of directions and jumping, um, then I usually don't have to backtrack, or I don't have to really be thinking what a pain generating site might be, because a lot of times these people are way more functional and they're in a lot less pain. I think patients a lot of the time will be feeling so much stronger because they have the ability to really absorb that force and not actually have like pain, so that it's going to keep them like continuing to progress like as if they're almost healthy. And it allows you to really optimize it a little bit longer. So I think, but now absolutely when I was younger, I mean, I just don't think that I had as much exposure as what I've had to over the last decade. um and I don't think that I understood even a lot of things from a rehab or a strength and conditioning perspective, that the way that I look at it now, you know. And I've looked at a million different like different cases that I've seen necessarily through uh other clinicians or other people, but just I would say the ability to reflect on things and trying to find where I would do better kind of took me or diverted me to thinking like I think I need to go ahead and strengthen these people even for a longer period of time. And then kind of looking at a lot of studies for ground reaction forces and everything for people in mid stance alone just from running. Like, you're thinking about 2.5 to 3 times their body weight, and then for them to be just in mid stance alone. Um, and then you think about somebody with a weaker limb and kind of maybe an altered gait pattern. Now that's going to be probably even higher. And so it's on a weaker limb and it's probably a little bit more awkward and they're starting to relearn. So that's where having the ability to use something that is decreased gravity helps. But let's say you didn't have that, that's where you really have to kind of build up with the fundamentals of strength and then start to express it through different pre-running series and dynamic strengthening series, etc. Uh, so when somebody gets returned too fast, I mean, one, let's just say obviously the easiest answer is that they're a much higher risk for re-injury. Knock on wood, I have not had really like I haven't had a lot of those problems. I mean, I can't talk across every single case ever. I'm not talking about just ACLs. I mean, there's different environments that you can't necessarily like account for, et cetera. But that's where risk for re-injury can always be high. Um, I will say though that like the other thing is too that now you can start to play with people's livelihoods and their dreams by them not coming back as optimal as they could. And then teams can lose just from that too. So a little bit more time maybe or readjustment of thinking can go a long way. And you can actually optimize somebody's performance while they're coming back from this as well. And whether that's somebody on the football field or in basketball or soccer, whatever it might be, like you think about whether or not they're going to actually be able to be as effective as a teammate as possible or as an athlete. Um, and it is something that there's a lot of the time the risk might not be worth the reward. However, if you are, I feel like the best way to set it up across the board is strength. Strength is king for a while, for a long, long time. And then obviously you have to build up their overall uh like condition and capacity to perform by exposing them a lot to that actual to to the demands that they're going to be faced with. So yeah,
Cool, cool.
I hope that answers your question a little bit.
Yeah, of course, of course. So, so nowadays there's like technology. So I kind of want to add like, how would you utilize or how GPS help you walk through like each phases? Can you
Yeah,
talk a little bit about that?
yeah. So I mean, I've loved like any type of GPS system from Catapult to Stat Sports to Connexon, whatever it might be. Uh, there's a capacity for that to help in any rehab setting astronomically, in my opinion. Right? Because what you're able to do at the end is also start to recognize what demand you just placed on that person, but then like actually what their baseline data levels look like and where it compares to that, as well as now possibly modeling what a practice or a game or something like that could look like. And I mean, when I was working with football, a lot of the time that was just something that we were able to do uh, on the side, on the side field, try to see what a top speed would look like, whatever it might be. And it is something that is extremely helpful. Like if somebody's not hitting certain KPIs, you'll actually be able to see that from their entire time of rehab. And you can have just that basic window or period of time on what the top speed looks like, if there's a step balance asymmetry, if there's certain things that are actually allowing them to, uh, be uh, optimized. Because now, let's say like they haven't been exposed to a lot of like high speed D cells or anything like that. Well, you know that that might be a day that you could focus on that, and now you start to build up that a little bit more. Exactly how fast was it? All of these different things, and really the modeling component of it, and then now the reintegration into practice is so much easier because you can look at what might transpire down the road when they are starting to get back into practice, give them a certain amount of exposure, not even just from a load perspective, but also like the load per minute, all these different things that uh, you can look and see where their teammates were at, where their proposed norms should be at, as well as where they were at before, and then kind of program accordingly. So, whether somebody's acceleration rate is still significantly off, or the ability for them to actually start to tap into uh, the high end speed that they were at before, or their capacity to actually work into a program to how many actual high speed accelerations they're able to get to. Those are all the benefits of having technologies such as GPS, and why it's been so interesting throughout my career to be able to utilize. Uh, it's it's a I'm sure it's a very fluid uh, it's a very fluid field right now, and I think that there's going to be a lot more growth throughout the years for sure. Because now what people are able to do is really start to recognize where the deficits are, and people are getting better and better at generating questions to actually help people get right and optimize performance when they come back.
Nice. So, uh, last part of the podcast, I want to ask about like, so after like, let's say after they have enough strength, after like they do a little bit like of running, a little bit of change of direction, um, do you still like uh do some test to test if their like ACL functions right or like PCL functions right?
Yeah. So if there was a PCL injury, that's usually a little bit harder to like test. Obviously, there's going to be the special tests that the doctor is going to see, et cetera. Um, I mean, anybody can go down the route of looking at it through, an MRI or something like that. But functional test wise, I still personally, in my opinion, isokinetics is still king in that regard. There's gonna be you want to try to have it within 10% of the other leg, with in regards towards knee extension, so open chain knee extension, and whether that's peak torque as well as like uh honestly, peak torque is always going to be kind of like my main thing that I would look at. It's not necessarily quad to ham ratio. I do think that that's important, but I would say peak torque, just trying to see exactly how that works, and you can kind of dive deeper into time to peak torque, et cetera. But so the isokinetics would be optimal. Now you might not always have that, so a lot of people go down the route of triple hops, a lot of different things, and I do think that there's a lot of value to those. Like you'll be able to see it. But if there is something that you can use with a little bit more objective uh, data that's not potentially as biased, I would probably go towards that in the sense of kind of coming out with a battery of tests that would be helpful, such as, maybe just isokinetic testing, isometric testing, and then even like force plate technology or force platform technology that would actually allow you to see that as well. Because with that, now on top of, I'm not even getting into the different like completion of KPIs, et cetera, from GPS data, but with those different technologies, like force platform data, as well as also like isokinetics, it can actually help you identify where the difference is along the curve, along the force time curve, whatever it might be, what could actually be causing that and how you can improve it, as well as also obviously comparing the asymmetries from leg to leg from an isokinetic test and seeing, what their supposed values should be. And from the consideration that the contralateral leg needs to be extremely strong as well. And if they're just grossly weak on both legs, but they're close, that might not necessarily be as safe as what you would think, because now that other leg's at significant risk for injury too. Um, and then the last part that I would probably go to are like GPS metrics that you can actually look at KPIs and how much exposure that person's actually had, how they're responding towards the different stimuli of practice, of anything like that. Different series of play and like more high intensity exposures. So that kind of is a combination of everything, as opposed to just like a triple hop test. I'm not saying that those aren't valuable. Like people should still try those, etc. But I think if you don't necessarily have baseline values as much before, if you're not doing those different field tests before, it might not be even as valuable, because you might get a little bit kind of more skewed data than if, okay, well, we know that we test broad jumps or standing broad jumps regularly, or we test this and they're still grossly weak. Now we'll try to check each leg and go from there. That might be more helpful as opposed to just doing something like that in the clinic that could kind of sway you to thinking, okay, they're good to go with a as opposed to something that's a little bit more harder objectively.
Nice, nice. Man, I put you in a hard position to answer a lot of like big questions. I appreciate you for answering
No, I
it.
mean, I talk a lot, so don't worry. So, but I appreciate it. No, that was fun for sure.
I enjoyed it. So, for those who are interested in what we're talking about today, where can they reach out to you?
I'm not even huge on social media in the sense that like I'm not on a lot, but they can absolutely reach out to my social media. They could also reach out to me through any email. So yeah, I'm always open to conversation for sure, for sure. So I believe my social media would be Jeff underscore Ruiz 03, I believe. And yeah, that's through Instagram. And they could reach me at my email as well, for sure.
Nice.